Thank you for tuning in to Global Elite Consultant, brought to you by Global Elite Academy. Please go to globaleliteacademy.net and give us a call if you have any questions. So now this audio is on IHSS for Vermont. Vermont does not have a single equivalent IHSS program. Theirs is called Individualized Home Support, which is IHS. So now the Individualized Home Support, IHS, this is a service provided under the umbrella of the State Development Disability System, offering support in the home and the community. So this is for disability people. Then they have AHS, Vermont Agency of Human Services. This agency oversees a variety of programs and service to meet the needs of Vermontians, including those related to home and community-based support. They have another one called Choice for Care. This is a service for older adults and individual with physical disability and may include homemaker services or adult daycare. Then they have the Global Commitment to Health waiver, and this is where the family member can be paid for being a caregiver. And they have the Intensive Home and Community-Based Service, which is IHCBS. It's a AHS program providing services to children and their family. To determine the most appropriate program, it's recommended to contact the Vermont Agency of Human Services or your case manager. So now, if you wanted to sign up for, to get your agency there, and you wanted us to help you sign up for what was equivalent to the IHSS program or something similar to the IHSS program, we could do that. We would have to research this a little bit more and find out which one would apply to you. Do you want to do the seniors, the children, or disability? So we would have to find that out, and then we can help you apply for whatever, whichever one you want to apply. Now, that's only on our one-on-one program. If you do our program that's do it yourself, we don't really help you with getting your license for IHSS. You'd have to talk to us, and you'd have to pay extra for that. So you could talk to me about it, and I'll see what we could do about that. But if you needed help with that application, because we really have to dig into it a little more. I'm not sure, they're not clear about which program. If you're going to do elderlies, you'll probably do the one with the senior program. But it doesn't really tell me what the regulations are. So, first of all, I know what we would have to do is figure out which program would apply to you. And then simply, we would apply for that program. I'm sure they would come out, because they usually come out, or they'll do a survey online. They do that, a survey online. So then you'll have to do a background check after you fill out the application. You'd have to do a background check. And usually after you do the background check, then they give you the date to when the survey is going to be, and they'll either come out or you'll give them everything they want. You know, it'll be online, an online survey. And it's probably they'll look through your policy and procedure manuals and do the survey through that. I don't really know, for sure, but I'm just saying what I think. And then they'll give you the certification and you'll be able to take those type of patients. So anyway, just, they have something similar to IHSS. It's not the same thing, but it is similar. So like I said, if you wanted to help, we would look into it a little more and figure out which program you wanted to get in and help you apply for that. If you do the do-it-yourself program, then we can, you would have to call them and figure out which program you wanted to do, and then you would have to complete the application by yourself. Okay, so like always, if you have any questions, please put them in the comments, and then we will answer them. So let me say this now. These programs are still, even though it's just similar to IHSS, it's still a community-based program being paid for by Medicaid. So you still would have to get that, your provider identification number, the NPI number. You still would have to get that. And you still would have to go through, whichever program you decide to go through, you still have to fill out the application, do the background check, submit whatever documents they say, upload the payment, and wait for the survey. And then you can start marketing. So you'll still have to do all those procedures, for the whatever program you decide to choose. Okay, so thank you for tuning in to Global Elite Consultant. I look forward to answering any of your questions that you may have. Put them in the comments, and I'll follow through on a follow-up video. I'll follow up on the questions. Thank you so much. Have a good week.